challenges around care management at home for the elderly and individuals who are suffering from chronic disease. And as I said, this is really a continuation of some of the conversation that folks have participated in earlier this afternoon. I'm Judith Sheft. I'm the Associate Vice President for Technology and Enterprise Development here at the New Jersey Innovation Institute at NJIT. And the space that you're actually in is our Innovation Lab. And in the Innovation Lab, we really focus on trying to work with large corporates as well as startup companies and help make the connection, because we know that large corporate organizations are looking for innovation activity and there's a lot of noise in the channel. And by vetting and working with companies, with startup companies, we're able to help make those connections for them seamless. This particular section on healthcare is one of our iLab focal points. We have other focal points where we work with biopharmaceutical manufacturing, defense and homeland security, civil infrastructure, smart city, which then also really from a smart city perspective also really kind of bleeds into the healthcare delivery set of activities. And so we're really delighted that you're able to, to join us on this conversation. And I really met one of our panelists, Juby, a couple of years ago when she was still at Anthem at an event that we were hosting here at NJIT as part of our healthcare delivery iLab. The iLab has received an enormous amount of funding from the federal government to help doctors transform the practice of medicine, to help them get off of paper records onto electronic medical records. And she and I started a conversation, and she was thinking about leaving Anthem and getting into the startup space and really using some of her background and seeing some of the pain points in terms of using technology to address issues that she saw. And so she and I actually met on a Saturday afternoon at a Japanese restaurant in Westfield, and she really took the leap and moved forward. So with that, I'd like to let the rest of the panelists introduce themselves.
Hello? Okay, there we go. Hi, everyone. I'm Rahul Dewal. I'm a digital health engineer with GlobeXL. I have a background in MRI research and engineering, doing electromagnetic simulation and optimization, and also ultrasound device development, doing electronics, hardware, and software prototyping. At GlobeX, I'm working on IoT and back-end development on remote patient monitoring.
Juby George-Vaze, whom Judith had lunch at a Japanese restaurant one day on a Saturday, and that's when I decided to take the plunge and go into the startup world. I am a nurse of 25 years, and I also am a certified case manager and have an MBA in health systems management with a finance and technology background. I understand the different components that take up the different, add up to the whole picture that is healthcare, and especially the friction points inside. I have the pleasure of being at the forefront of healthcare as it is evolving, and have the blessing to implement large-scale programs nationally before I left to start GlobeX Health, which we provide an amazing job in innovating. And additionally, I want to do an introduction to one other person who is not here, which is our medical director, head of population health, Dr. Joyce Grossman, who is one of the other ex-Anthem person who left and joined with us. She was the regional CEO for Empire Blue Cross and Blue Shield and Anthem for Medicare business. She has 3 board certifications. Prior to becoming a doctor, she was a genetics researcher and a biochemist.
Hello everybody, my name is Fazel Keshtar. I'm assistant professor in computer science in St. John's University in New York. My research area is natural language processing, AI, and machine learning. My main work was in text analysis, regarding emotion and sensory analysis, and personality detection and conversation. And our recent research was disease outbreak detection in using social network data, and also aggregation detection in video data. And I have some experience on working with Pepper and Alexa.
Hello, I am Christa Rapoport. I'm a Rutgers educated baccalaureate nurse who once practiced at Thomas Jefferson University Medical Center for 3 years, and I went to UVA for law school. I was in the insurance industry for years, where I was associate general counsel for a global property and casualty company operating in 130 countries. During that time, I helped draft exemptions for the property and casualty industry for HIPAA and limitations on Graham-Leach-Bliley. I'm on a couple boards, and I also now am a nurse in healthcare on the agency production side. So for agents and brokers now, with many of the insurance companies, we are embracing technology in a way that has not been embraced before. And we're an industry which has not had to adhere to the privacy, security, and compliance pain points of the health industry. Juby brought me on, and here we're talking about implementing new technology and looking at the pain points that we have, looking at the structures and how we can keep patients confident that the information and data they're providing is going to be kept safe, that the transmission will be safe, and that will be segregated, and that use will be on a need-to-know basis.
Hello. So my name is Joel Park. So I'm an assistant professor of clinical emergency medicine at New York Presbyterian Law Cornell. And I actually have two titles. I'm an emergency medicine physician. I see patients several times a week, and I also am a data scientist. And my other work focuses on research on hospital optimization and flow. But I also work in the technical and healthcare advisory perspective for Globex Health and been involved with some of the projects with the company.
So I want to just talk for a moment about the overall entrepreneurial ecosystem in New Jersey, in which startups and insurance companies and large hospital systems are finding themselves. As I mentioned, I met Juby a couple of years ago when we were in the midst of a program that we continue to run called Health IT Connections, where with some support from JP Morgan Chase, we were able to bring together cohorts of CEOs from health IT companies, and it was a broad definition of what was a health IT company, to have them work on particular challenges and to get these businesses to look at their business models, to help them with investor pitch decks. And because we specifically called the program Health IT Connections, we're able to connect them to investors. In fact, there were some other of the investors who are speaking earlier at this conference on investing in voice, or some of the connections that we have, as well as connections with some of the hospitals who themselves have innovation groups and are looking to put dollars into acquiring new technology. So there's a lot of activity going on within the overall New Jersey entrepreneurial ecosystem. Of the 150 companies who participated in our program after the 5 years, and we continue to track what they've done, their revenue growth has been about 27%, their employment growth has been about 22%. We're continuing to run those programs, so if people are interested, please let us know. So now we're going to really switch to some questions to the panelists, and I'd like to have them give a bit of an overview about their role has been in the evolving landscape. And so Juby, I'm going to have you start, and you're going to have to kind of tell me when I need to move the slides for you.
Okay, will do. And to tie into what Judith was saying, New Jersey has been good to us. We're based in Newark. We're proud of that, and that we are part of the healthcare ecosystem here, and also the tri-state area and outside of the tri-state area. But we got our opportunity through NJIT and through the program, and it's a good place to be, to start something out. So about Globex Health. We are, from hearing all of us, it's a little bit of an outside-the-box healthcare innovators, but our healthcare system currently is broken, so you have to do something different to kind of have some sort of success impact. And we know that area so well, and we are able to navigate the new landscape and understand the reimbursement structure. We have 3 lines of business. One is more focused on digital health, which has remote patient monitoring, which we're going to be talking later on. That has a little bit of AI component and a somewhat Alexa. Telehealth enablement, so we have a complete end-to-end package where any physician office or ACOs or hospitals who wants to enable telehealth as an add-on to their existing service. We provide from 0 to 100, including the training, policies, procedures, compliance, and a lot of the regulatory aspect of reimbursement and compliance is very difficult to track. We have all that built out. And we are extremely knowledgeable on the reimbursement since we are ex-insurance experts. And that also comes into play so that what the physicians do and one of the problems in the telehealth is revenue and reimbursement. We make that happen. We also have the big data analytics and population health, and we also have an offshore team that does some of the analytics. Second line of business came out of a request by the New York Healthcare Financial Readers to me as at a board position to figure out a theoretical solution to a friction point in healthcare, and that's blockchain in healthcare, because I was working on a project outside of that on it and came up with a solution. So we are developing a private consortium in blockchain, and we have also healthcare revenue cycle optimization side. It comes out of the telehealth and other. Every time we see a practice or other, we see the problem from healthcare finance, and we kind of suggest optimization. It turns into another side of revenue. And we have a third one, a little more interesting, which is the research enablement. We partner with others on biotech or genomics. So the problem in healthcare is the high cost. We have a 3.5 trillion, about 18% of our GDP, and of which about 705 billion is Medicare spent, and which is our aging adult, 65 and older, who have paid into the system, who have the right to receive care and services through Medicare. And we have $1,142 billion a year problem of hospitalization expenditure. So that area is where our remote patient monitoring and some of the technology impacts in reducing cost. Anytime you avoid a hospitalization, you avoid a high cost. Because each hospitalization is anywhere from $3,000 on the low end to $200,000. As you age, you start to live with multiple chronic conditions. Seniors who are growing, they have hypertension, diabetes, COPD. So that is a common factor. And if you are able to capture data on what's going on with them, with the wireless devices, some of the devices we have is wireless blood pressure, wireless weight scale, and additional other devices, and able to track and trend, and I don't know a little bit about predictive modeling, then you're able to say something's going on before that tipping point, what we call something bad is going to happen to them where they end up in the ER. If you have a hypertension or CHF, congestive heart failure patient, tracking the weight and blood pressure kind of tells you when there's an additional excess water gain, and you can talk to them, talk to their doctor, or us intervening, because we do have physicians, and figuring out a way, based on what they have, to reduce that excess water rather than ending up in the hospital or ER. Our seniors are finding that they're more calmer, not as worried, and able to enjoy their life a little bit better. This decline or reduction in ER allows for high cost saving. And that's also an area we find Alexa to be helpful. Many seniors like the positivity of Alexa. Some of them use it for tracking their medication and additional maybe CHF or COPD. If they have a CPAP or other devices where they need to use it regularly, Alexa can remind them. And there are other things that we are working on or we have that makes an impact in the healthcare. So this clinical intervention and combined with digital healthcare has a tremendous impact in quality of life, extending, at the same time, reducing overall costs. That's what the new healthcare landscape is. There's a lot of components that some of us will be discussing down the line, which has the compliance issue, The cost of technology has gone down, so that's a little more easier. And then consumers and patients, family members give them Alexa. Our patients want certain things, and they have a right to. So it's consumerism, consumer patient generated, and it's also personalized. Insurance and others, there are middle layers of reimbursement built into a certain aspect of it because there's value. If you can avoid spending $2,000 or $3,000 by spending $100 or $200, then yes, there's some ways of making it happen. And one of the common places you find is the latest keyword is social determinants of health. So that's an area that you seem to find funding and reimbursement there. There's a lot of regulatory and compliance that goes into it, and there's change in fee-for-service space to value-based payment models, which was covered in an earlier session, is one of the drivers to this area. So I wanted to introduce one of our Alexa super users. Jerry is 70 years old. She has multiple conditions. She lives by herself, retired paralegal, and she has 4 Alexa Echo Dot devices, 5 smart plugs. She has 16 medications that she takes. And she also has an Alexa-enabled smartphone, and she's holding an Amazfit watch that she uses that is Alexa-enabled. The reason I mentioned that company is because it's one of the partners that we are working with. She enjoys it. She also is one of the ones with the CPAP machine, so Alexa reminds her at 10:15 at night saying, "Do you need to go to sleep? Turn on your CPAP, or did you turn it on?" In the morning, there's a lot of these mental health area that seem to be addressed as able to build into a conversational, which is, there are tools and apps that we can enable that has positive feedback or positive inspirational wording. And she also uses Alexa for making phone calls. Rather than trying to type or trying to punch in buttons and trying to figure this out, just saying it out loud she finds it very useful. I'm making notes, grocery list, and also for notes for her next doctor's appointments, various different appointments. She can section it up and also have Alexa take the notes. That's an area that we really find it's really helpful for people. And then now I'm going to hand this over to Fazel, who's going to talk more about it.
Yeah, in terms of technology and using robot or social robot, how we can engage this type of technology to healthcare, especially in elderly people. So research shows this companion robots or assistant robots, such as, let's say, Alexa or dialect system. We can improve the mood and emotion of the elderly people and people with disability, and also loneliness, and they cannot, for example, do themselves their job by themselves. So the robot can help them to improve their mood, improve their emotion, and improve their mental health. However, not a lot of systems are in the market, although there is a lot of research and there is a lot of application. But according to our finding, we found that there is still a lot of gap that we can cover in this area to help people with this type of problems, especially people with disability or elderly people. So our solution is to just use this type of social robots, Alexa or dialect system or bots, to help these people in terms of mood, in terms of the emotion, in terms of the just normal interaction, human being, and when they are lonely or they are depressed. So these things can be improved. You never know, maybe one day Alexa will try. I don't know.
That's a good job.
So next slide. So this is a framework that we proposed, we published last year in the ACN conference. Just imagine you have a multimodal data. Here is like image, video, I don't know, VR, VA, and audio, voice, speech, dialect, conversation, motion tracking, eye tracking, EEG, multimodal interaction data, and a lot of other data that are available. And suppose in human being we cannot capture or save all this data or interaction. But if you have a robot that interacts with such people with this type of problems, and the robot can detect or save at least all this data for us. And in terms of psychological feature, we can detect all these psychology feature or linguistic features to find, for example, using machine learning and natural language processing or AI in general, to detect this type of features, such as emotion, sentiment, mood, And at the end, what is the purpose, for example, in this case, for people with the mental health or depression? At the end, we can analyze this data using robot have a conversation, different conversation to induce the mood, to have a little bit psychological safety for the person, or change their mood or change their behavior. Okay, I think you feel depressed, you probably need to take a rest or drink the water or something that can induce their emotion or help them in terms of psychological safety. So now I answer to.
All right, you can move on to the next slide. So I'm going to be speaking more from the clinical perspective of things. So, this is actually a real patient. Her name is Teddy. She's a 9-year-old female patient with multiple medical problems. Typically, she's quite independent. She lives by herself. She can drive, she can cook, she can perform all her usual daily activities of living. But, Teddy, she hasn't always been like in this case. She hasn't always been this healthy as well. And some time ago, she's been hospitalized for an illness that she succumbed to, and ended up having this complicated prolonged course where she's going back and forth between hospitals, acute rehab facilities, and back and forth until one day she was fine and well enough to go back home. Now, as you can imagine, she looks okay now, but from a clinical side perspective, as well as from like a more personal side of things, a patient like this who lives by herself, who's to say that something like this won't happen again? And it makes a lot of people nervous, including herself as well as her son, who happens to be living out of the country. So just to notice, if you look at this picture, you notice that she's wearing a smartwatch on her left hand. This is a Amazfit that's been powered by Amazon Alexa. And while voice AI could be one tool that could help, potentially assist with her living and make sure things are okay, all the combination of voice AI plus the elements of a smartwatch, plus other tools so this patient has received tools from Globex Health, including like a wireless scale, blood pressure cuffs, and so forth. All that's actually been helped to ensure that she is being more safe than she was before, and this puts a lot of ease onto both the patient as well as her son. Next slide, please. So, Teddy is just one of many, many patients in medicine, like the overall patient population is getting older, and that's not a surprise to anyone. But, as patients get older, there's been this increased complicated medical care, and as well as social care, right? A patient who's 95 years old may have some other issues that, for example, a 45-year-old patient may not have. And, we're in an age of information. All the information that we gather, both from electronic health record systems, including images, documentations, vital signs, lab work, and so forth, in addition to a lot of the data that collected from the IoT, that combination of information can lead us to, allow us to do new things. And this is not a surprise to anyone here, especially for the technologists in this room. Next slide, please. So from this data set, and then speaking from a more of a data science perspective, when you have all this data, right, you can input that in and make some information, both inferential or descriptive statistics, as well as predictive analytics, including machine learning. And from there, you can then use these tools and this information to help patients. For example, is something going to occur where a patient who was previously moving around, who lives by herself, has now stopped moving? Is there some sort of detection if the patient had fell, right? And then can this alert to someone to go look after her? Or is this going to predict if the patient is not going to adhere to his or her medications? That is also a problem. Or if the patient's blood pressure is steadily rising and the patient has underlying cardiac disease, could this indicate that there may be a potential recurrence of congestive heart failure? So ultimately, at the very end, I think from a clinical side of things, we want to use technology and including voice technology as a way to help patients overall, because ultimately the technology is not there for the sake of technology, but ultimately to help improve care.
So maybe Juby and Joel, I want to kind of dig in a little bit more on the question of using voice to improve healthcare outcomes and some of your experiences that you've seen with patients in these clinical settings.
So I'll go first. So, like geriatric, so there's a lot of research that's going on in the medical community about the geriatric patients, and I'm specifically talking about like 75 years and older. And, I hope I'm not offending anyone, but this particular group of patients, they end up having a lot of medical conditions that are unique to that population group, and may not always, and a lot of doctors or patients or people, families themselves may not be totally aware. And then so this is actually a wealth of opportunity from from a technology standpoint of view, to be able to help identify, again, like what I was talking about before, if a patient's not taking their medications, patients at risk for having an adverse outcome, such as, for example, something drastic, a stroke or a heart attack, and having them come back to the hospital. So again, like, you know, this type of technology has really, you know, so far it is in its infancy, as well as I've seen some of the previous speakers talk. But again, you know, like as someone has mentioned before, you know, you have to hit for the home run in order to keep on progressing and trying to work forward to these goals that ultimately one day will show up and be productive.
And I think what you're also going to end up seeing, I mean, he talked about the 70-year-old, but I really want to say, I think it's really the 70-year-old is like the new 50, because we are seeing people living much longer. Some of the stats from the Institute on Aging are really indicating that people age 85 and up are really going to be a quarter of the elderly population, so that people are living longer because of other treatments that they're able to get for disease states that they have.
Yeah, I agree with you. And we're noticing, you know, our 70-year-old Jerry is an ideal case. She's tech savvy. She's a retired paralegal. She knows technology. She uses them. And you're going to keep on seeing that, and that's also going to allow them to live better, longer. And they're going to take care of themselves a little bit more, not compared to the older, a little more older generation. So what do I see in the clinical setting? One of the things that I came out of is there are a lot of things that's avoidable and preventable. Now you hear about the readmission of whatever year and all that, but in the earlier years of case management, care management, which I have a certification in, maybe about 18 to 20 years ago, that was like, how do we avoid it? There was no tools. And at that time, insurance companies said, oh, we can just throw the kitchen sink. You throw in like, you know, $5,000, we can prevent $200,000. Why not do that? So I was one of the people who were asked to create a program and design and implement it. And we successfully executed and was able to reduce overall total costs extremely, which became a national program. So we took aspects, and Dr. Grossman was involved in that too. So we took aspects of that, and that's available, and brought it into an area that's easily applied. From our viewpoint as clinicians, it may not be on the other side, but easily applied. That's very simple, intuitive, and low cost, but has the most highest impact. And how do, because it helps from, I have fall, you know, what we used to see on TV, I'm fallen and I need help or something, like you have that one little button you can press. That's not the case anymore. You can call, Alexa, call 911. They can call for you. That's a big difference.
Just to piggyback on Judy, what are things we see in the patient population? What do we see in ourselves? Do we like going to the doctors? Is it a hassle? Do we always comply with taking our medications? Wouldn't it be wonderful and easy to have something to help us with that, to monitor it? So I see compliance of patients, and also an exquisite ability for clinicians to have real-time accurate information with real-time remote monitoring. So I just think that having a complete patient record leads to better information, to make better diagnosis, to make better suggestions for patients, and then to monitor that patient care. So I do think that this is a game changer, and it all in will result in better health care for older Americans and all Americans.
So Fazel, do you have some further comments on treatment of the elderly?
Yeah, in terms of technology, I think there are a lot that you can detect from the voice. I'm sure you are aware or not, maybe. Recently, in the media lab in MIT, they use the voice to detect, to paint your face based on your voice. So without even knowing any feature from you. So they could paint your face from your voice. So why we cannot detect the illness, especially in our use case, elderly people. So suppose every morning elderly people are in nursing home. So talking 5 minutes, 2 minutes, 3 minutes to your robot, and this robot can detect all your information and send your physician, and physician can report your information to your, again, back to your robot and say, okay, you know what, you need to take care of yourself, probably didn't have your medicine. However, a lot of information we can detect from voice, such such as mood, personality, emotion. So I think anytime you hear from your friends, you look tired. Your voice is different, right? So we can detect a lot of information from voice that we can help elderly people, especially in this case, or people with mental health or depression.
Yeah, and really kind of picking up on what you said, Fazel, one of the TED Talks I had listened to one time was from a physician in the UK who was able, by listening to someone's voice, it was an early detector of Parkinson's disease. He was able to catch some of the changes that they could hear in the voice that were going to be indicative of further problem and indications for patients, so that you're absolutely correct that voice is more than just your voice.
Absolutely. Yes.